Hi, I'm Taylor Cohn. I am a first-year dental student at University of the Pacific Arthur Dugoni School of Dentistry. Yeah, so that was back in March, and I was in a gap year at that time. I graduated from UC Davis in 2019, and then I took a gap year. And so actually at that moment when COVID kind of was hitting, I was on my way to Utah visiting my sister. So as soon as that whole thing was happening, I was going there to celebrate my birthday in Utah with my sister and my niece and nephew, and then everything got crazy, and so I got stuck in Utah for about a month. I was there from like March to April. Yeah, so I spent my entire gap year. It happened all of a sudden. I was only expecting to be there for like a weekend. And then both my jobs, I was working in a dental office and at a restaurant, and they both let me know saying like, we're gonna be closed until who knows when. And so I decided that the best thing to do would be to stay in Utah for a little bit. So my quarantine or my gap year definitely went not as planned, but it all worked out. At that point in time, especially earlier on, it never was a thought in my mind because I was so set on dental school. I was so set on entering the year that I did, and I never really had any second thoughts about it. I know that a couple months in, I would see posts from current dentists, and they would do polls saying like, if you were a dental student at this time, would you defer? And some people were saying yes, and that's the first time that ever came across my mind, because our school is doing really well at communicating with us as far as the transition to making it online. So we knew ahead of time that it was going to be online, and I kind of just came to terms with that. But as time went on and COVID got more serious, and that was unexpected, I started to see why people were deferring. And I don't personally know anyone that did defer. I feel like, at least at our school, they've done a really good job at making sure they're taking all the precautions they can and being as safe as they can. So I don't feel any regret as far as deferring a year, but I can see why people might consider that. Well, moving to San Francisco, there was a little bit of a concern there because it is a big city. However, as soon as I moved there, it was like San Francisco that I've never known before. It was empty. The streets are getting a little more populated now, but it's still very empty in relative to what San Francisco usually is. And they have definitely been taking the COVID situation very seriously. And it's definitely stricter than it is down in Southern California where I'm from. So I think that was a really good transition, and it was a surprise to me at how serious San Francisco is taking COVID. And so that kind of made my family feel better about it. And then also previously working in dental offices and talking to the dentists there, they would tell me about changes that are happening and being implemented in response to like safer procedures during COVID. So just being able to communicate and see how different professionals and fields are responding to COVID has definitely made me feel reassured, and it's made my family feel reassured as well. Yeah, okay, so let's see. Orientation week, that was done virtually over Zoom, and I think the school did a really good job as far as allowing us to meet each other and trying to host little bonding activities and breakout groups and with fun games. And I think that was actually led by, I think ASDA had something to do with some of the fun activities that we did. So it was nice getting to meet my classmates that way. However, right before school started, when people started moving to San Francisco, that's when we started to host, or people put on these like meetup groups in the park. And so a couple of our classmates would show up, and that was a great way for us to meet each other in public, in like a safe outdoor environment. And it's really fun too, because even like months before school started. This was back when people started getting accepted. I made a Facebook group for UOP students that were in our class. And so we started communicating very early on. And so we started hosting Zoom calls, and we would probably have Zoom calls like once a week where whoever in our class was available, they'd just hop on the Zoom call and we were able to meet each other that way. And so I think it was really nice being able to create these connections with my classmates early on. And based on what I hear from other schools, they didn't really have that. And so that's definitely been a big factor as to why I love UOP so much, is because our class is so good at getting to know each other. Yeah, so they just added these new kiosk things at the doors, so it takes our temperature, and then before we check in every morning or every time we come onto campus, we have to fill out a health questionnaire, and it asks questions: are you having symptoms, things like that. And so as long as that gets cleared, and then we go in through the doors and they take our temperature, and if that gets cleared, then we're allowed to go through. Of course, on campus we always have to be wearing masks, and I know they gave out some of the head, what are they called? The like the full-on head masks or whatever they're called. I don't remember. So they've definitely been making sure to remind us that we are social distancing, and with them limiting the amount of classmates that are on campus at a time, it helps with that. And they've been really good at making sure they send out emails to us and keep us informed as far as any changes that are happening. And I don't think anyone's felt in danger at all. So they've been doing a really good job at making us feel safe. Yeah, so that's something that I always keep in mind, is making sure that before I go home or go anywhere, that I feel comfortable enough to be around them, especially my parents. They're not young, so obviously they're in an at-risk group. My sister actually got COVID too, and so she's had to quarantine herself, and she's in Northern California. But yeah, I didn't want my parents to worry about having another kid getting COVID. So I'm always definitely taking precautions as best as I can. And as far as quarantining goes and staying safe, I'm pretty much just with my classmates all the time and with my roommates. And other than that, I don't really get so much outside engagement. San Francisco does a really good job, like I said, at making sure that we are safe, and still things aren't really open. So I didn't really feel like I was at risk of bringing anything home to my parents. And it's definitely been different, because in SoCal, you don't really have to wear your mask all the time. So if anything, it's coming back to San Francisco where I should be more careful, in my opinion. Yeah, so with the military, that's something that I always imagine myself doing. With dentistry, that's been the only path really that I considered. Not just for financial reasons, I know that's a huge enticement for people, but also because I never really saw myself settling down anywhere, at least anytime soon. I like the idea of traveling, and I like the idea of being able to practice dentistry in an environment where I don't have to worry about the patient's financial background, and I don't want to be limited on how I can treat them based on that reason. So doing dentistry in the military is the only path that I wanted to take. And so after I finish UOP, then I will be serving 4 years. I'm on a 4-year contract, so 4 years in the Army, and I go wherever they send me. I believe I get like a list of, like, there's like a top 10 dream list that I get to choose places I want to go. And I really want to go out of the country. And I think it's obviously a lot harder to practice dentistry out of the country if you weren't in the military any other way. So that's something that I definitely want to do. And I don't like living the traditional like way of life. I just don't like redundancy. And so with the military, it's always kind of just like, you never know what you're going to get. And I like that. I like that spontaneous way of life. And I am hoping to specialize in the military, which would elongate my commitment as far as how long I serve in the military. But I would love to pursue oral surgery or maybe prosthodontics, or I'm not sure yet. I'm still figuring that out, but I do want to specialize with the Army because it is a little different the way you go about specializing. But because they present that opportunity and they encourage it, actually, I think that it just really works out for me and for what I want. So that's kind of my thought process. And if I end up loving it, then I'll probably retire in the military. If I don't, after my commitment, then I'll just come out and maybe start my own practice. By then, I hope that I would be confident and ready enough to start my own practice. But at least for the next 4 years after dental school, I kind of have that figured out and don't have to worry about the business side of things. Yeah, so I am still trying to take the advice I'm about to give. So I've definitely learned my first quarter of dental school that it's so important to not compare yourself to others. And I'm sure that gets said very often, but especially in dental school when everyone's learning so much for the first time, especially in sim lab, we're learning so many different techniques on things, and we're prepping teeth for the first time, especially at UOP. SimLab is a big proponent of our first year and on. So it's definitely been difficult because I recognize what I'm doing wrong as far as hand skills, and I can tell that I need to improve certain things, but it's hard in the beginning because you're not at that level of improving your skills yet. And so you'll see your classmates and you'll see their preps and they might look better than yours, but you really don't know, especially when grades come around and you turn in your first prep. Some preps might not look as good, but they meet the certain criteria. So it's really hard not to compare yourself to others especially when it comes to hand skills, because everyone starts from different places. Everyone starts with different backgrounds, and hand skills is something I thought I would not have to worry about because I consider myself a creative person, and it's just been difficult being able to recognize that I'm doing things wrong, but I can't yet improve them. But I know that comes with time, and it's expected. I'm not surprised that it's a struggle for me right now because we move so quickly, especially at UOP. And I love that. I love that we get early exposure. And I know that it's only going to be uphill from there. But I think for incoming dental students, it's really important. Don't compare your work to others because everyone starts from different playing fields, and eventually it'll all even out. And practice makes perfect with this kind of thing.